Welcome back to The Remedy, brought to you by Coos Health and Wellness. Again, I'm Eric Gleason, and we have brought Dr. Brigham back to discuss a little bit more about opioids and treatment and effectiveness based on just the sheer number of issues that we've seen in the community. So thank you for hanging out with us and doing another show with us.
Thanks for having me back.
So who's at risk for becoming addicted to opioids?
Yes, that's a good question. So there are a lot of stereotypes about who gets into problems with substance use, but really anyone can be vulnerable. So a person can have a perfectly good and normal life going on with robust family relationships, employment, and so on, and have to use or find a need to use these opioids as medicine, for example, for a period of time, develop into a dependence and then an addiction on them. Nobody really comes at it saying, I think I want to be addicted. Most people think they won't have that kind of a problem. So it's virtually anyone can be vulnerable to addiction.
Right, this isn't something that affects like one population more than the other. You can hurt your knee and then have the effect of the opioid make you feel in a certain way that it continues.
Yeah, so the knee injury is a good example that here in Oregon in particular, there's been a very high incidence of non-medical use of opioid medication. So in some areas of the country, heroin is really bigger, and heroin is definitely a problem here, but prescription opioids has really driven the crisis in Oregon, and that is where a lot of people are exposed to these medicines to treat pain, either acute or chronic pain, and then it develops into a problem. The brain chemistry, the chemistry in the central nervous system adapts to the presence of these opioids very rapidly. So this is why dependence can develop so rapid. They are very euphoria producing, so euphoria being a sense of well-being. So a person who's distressed by pain can go from that distressed state into feeling pretty okay or even good by just taking a medicine. And then very quickly the central nervous system becomes adjusted to the presence of those so that when they're absent, the person does not feel good, in fact feels worse, maybe even sick. Also, taking them for chronic pain over time can make them more sensitive to pain. So even though it helped them initially, over time it makes their pain worse.
It actually complicates it. Yeah.
Yes.
So you talk about adaptive treatments, and now are treatments for this kind of addiction based on all of those things that it does to the central nervous system, are they effective?
They are effective. They're also pretty necessary for most people who get into trouble with these. The use becomes constant. A person has to take an opioid every few hours, multiple times a day, just to feel normal. And that's extremely hard to interrupt on their own. So treatment is pretty important, almost always necessary. We're fortunate we have several very robust medications that help us interrupt that use, treat cravings, and engage a person in recovery. And we see really remarkable recoveries. Sometimes we'll have a little trouble teasing physicians into getting into this area of work, but once they're exposed to it because of the remarkable turnarounds we see in people, they really enjoy the work and want to be with people. So there's a lot of suffering initially, but if people embrace treatment and want to get well and they get the proper treatment, we really see lives restored. Now, sometimes people question if it's effective because someone maybe they've known or heard of has gone through treatment and then re-experienced a problem. It is a chronic condition, so it requires ongoing attention, and people do sometimes relapse. That doesn't mean treatment didn't work. Treatment is an ongoing process.
Sometimes relapse is part of recovery in the long game.
That's right.
So if you feel you need to reach out for assistance, please look into ADAPT, both here locally. There's in Roseburg. They're all over the place in this area. At least they really try to reach out. I know that much. Information will be on the screen. So please take that in mind. And for The Remedy and Coos Health and Wellness, thanks for joining us.